Welcome to Your Infinite Health. Are you getting older?
Are you feeling it?
How would you like to do that in reverse?
We're your host,
Dr. Tripp
and Lene.
We've run an integrative medicine practice for 13 years.
Together, we have 60 years of combined experience helping clients.
We've helped tens of thousands achieve success in health and live longer, happier lives.
In this show, we'll cover peer-reviewed and evidence-based integrative approaches to creating the health you've always wanted.
We also share professional experience we see in the field every day.
So if you're ready to feel, look, and live your best life, you're in the right place.
Welcome to Your Infinite Health podcast.
Hey, Tripp.
Hey, Lene.
What kind of doctor is Dr. Pepper?
I'm not sure.
He's a physician.
It's so bad.
So bad. So funny. You know, they say laughter is the real medicine for the soul or the body, or I don't know what they say. Laughter is good for you. Laugh more often. Well, speaking of laughing is good for you, not that this is particularly funny, but you wrote a book, or I guess we wrote a book, but you're the major contributor to it, Think and Live Longer, available on Amazon. So this book, and we may have talked about it before, but this book was kind of born out of handout that we started giving to the patients, and they started to be interested. They were interested in it and read it, and then it just kind of evolved from there, from handouts into a book, and now every patient at Infinite Health gets one, and this is the mind-body component, one of the 4 pillars of our core health optimization program. And it's probably the single most important pillar, I think we both agree, because it's designed to help the patient shift their thought processes, beliefs, and actions into supporting what their health goals are. And I think the approach we took here, self-appreciate is really good and novel, because mindset has been a key component of achieving success in business for decades. And
I would say virtually every domain of our lives.
Well, yeah, but in particular, I think the focus has been on business and finances and money, like the Napoleon Hill and what's that guy's name? Walter Wallace or Waddle? What was his
Waddles,
name? Yeah. And then you forward and you've got guys like Zig Ziglar and Brian Tracy, and, you could maybe even talk about Tony Robbins, really kind of taking those
Jack
Canfield, taking those think and grow rich principles that have been heavily embraced and adopted in the business community. But until you and me, nobody has really taken those same principles and flipped them into how to achieve success in health. And so I think and Live Longer, one of the first chapter in there is all about that first step, that really shifting your thought process and how do you achieve success in health, and what does that look like, and what are the components to getting there. And so I was hoping that you could, in your expertise, delve a little bit more into that, because I know when a new patient is coming to you, this is kind of like the first step, is really shifting that patient's thought process. Because in our experience, we see that patients are very acutely aware of what they don't want. That's the pain point, whatever it is what creates the action of them actually coming into the office, right? So it's a reactionary process, because when you feel good, you don't think about going to the doctor. So there's a pain that's happening. You've identified it as something you don't want, and that drives you.
It's something you want to get rid of.
Right. Into the office. But what you then do with that patient, because they haven't really, here's what I don't want. But most of them, and you correct me if I'm wrong, don't really take the time to envision what it is they do want, right?
That's true.
And so I think chapter 1 is success in health and Think and Live Longer.
Maybe in a superficial kind of way, that they some people do on occasion come in with a reversion of the symptom that's what they desire. But conceptually, as for overall health, that global conception is never there, and it's never something that they can use as a metric for success.
Well, so for example, if you're in your career, people set goals. I want to achieve $1 million in 12 months, or I want to be a vice president of this company in 2 years. And so in business, I think we've gotten accustomed to creating an identifiable goal. And then, in the words of Stephen Covey, and that was another name, right? Beginning with the end in mind and working backward. And so you actually help a patient do that same kind of step but with regard to achieving success in health. Again, I know I keep saying that a lot, but that's really what you're doing. And so even from that first visit, are they not guided to envision what their happy end result is with respect to their health outcome?
Well, that's exactly where they need to be driven. And I guess really, when you think about it, the beginning of any goal is really related to, is typically related to fantasy. And so fantasy becomes, like you were saying, I want to be vice president of this corporation, or I want to be this or that or the other. Or this is the end point that I'm dreaming about. I'm dreaming about being in that chair. I'm dreaming about, taking care of this many people and doing this and that.
So
it
I
always
think
begins like a
Jim
fantasy.
Carrey is a good example of this, because I think he actually talked, that's the dog, by the way. He actually talked about being like on a hill in Hollywood and maybe seeing the Hollywood sign, and some of this I may be making up in my brain, but you can look it up, where he visualized getting, a role and becoming famous. And I think he maybe had even wrote out a check to himself for $4 million.
I think it was 10.
Oh, 10 million, whatever it was. And then he got, not immediately, not like the next day. He had this visualization, and the next day he got that breakout role, or the one that kind of made him more famous, because I don't think he was particularly unknown at that point, The Mask.
Mm-hmm.
And I think that the amount of money he made on The Mask correlated to what he had visualized and made the intention for when he was doing that process.
Interesting.
Oh, you didn't know that?
Yeah, no, I think I didn't know it was The Mask.
I think that's what I read. But listener, you are more than welcome to look that up and let me know what facts I've gotten wrong, because it's been a minute since I looked into it. But I thought that was a great example of how that process.
So the visualization process and the imagination being what it is, creating those images and those fantasies and the dreams of happy endpoint are the things that start the process of creating a goal. And I think Albert Einstein said it. He said, imagination is everything. It's the preview of life's coming events. And so as we imagine things,
in some minds that could be very dangerous. I mean, if you think about the mind of Stephen King.
Okay, stop.
Just saying.
So as the imagination goes, eventually the imagination and the dreams become so prevalent, and the individual starts thinking, well, yeah, I can do this. So, and the requirements for doing that are actually pretty simple. The requirements are basically, are you capable? And capability, unless for anything that's within the confines of natural law, we should be capable of doing. And then the driving factor is ability, and then willingness. So willing and able. So willingness is, are you willing to do anything it takes to get to that outcome? And so, because you're trading off time for acquisition of that endpoint. And so if the decision finally becomes, instead of dreaming about it, you're going to make it happen, then that's when the fantasy becomes a goal. So that's really the real key to understanding that health is the same way. I mean, many of the patients I see have multiple medical problems, and they've developed them over years. Of course, all of them want them gone at once. But
I want it all. I want it now, and I want it delivered yesterday.
don't forget gift wrapped, right?
All right.
So the thing about it is that if you have finally decided that that's going to be the case, and you have even multiple medical problems, then creating the image of that goal. So that's what the fantasy has been about all the time. So if you're, a diabetic with multiple complications of your diabetes, with nephropathy and neuropathy and, obesity and all of these metabolic problems that come along with diabetes, and then in your mind, your frustration ultimately, or your dissatisfaction with what you're able to do at that point, drives you to create that fantasy of health. That's actually the tickler to say, this is what I desire, and just begin thinking about, well, am I willing to do what it takes to get that outcome that I want? I want to be, I want to be active with my family again, playing golf, doing, going to concerts and theater, doing whatever you like, and not having the burden of thinking about your disease process,
which is kind of challenging. If you have a toothache, it is hard to imagine a life without a toothache.
Oh.
Right?
No, it's easy to imagine life without a toothache.
But you got this throbbing pain in your mouth.
Right, but you're creating the image of being able to masticate easy.
Masticate. Sounds like a bad word. Okay. Anywho, okay. So you find that people are not challenged by trying or envisioning a successful health outcome, even when what they're experiencing in the moment may be pain or discomfort.
Well, in the acute setting, it's much more difficult to focus on what you desire, obviously, instead of what you don't want. You don't want to be in miserable pain. But thinking about I'm talking maybe more in a chronic sense.
Mm-hmm.
So something that's happening acutely has to be taken care of acutely. That's really not much time for reflection, but something that's happening over the long term, and that has occurred and developed over the long term, and has multiple ramifications to your life, then that is the situation where, unless you create the image of success, that image of well-being and activity and thriving and vibrance and all of the happiness and all of those things, unless you actually create that image, then the decisions you make, you won't be able to implement and understand if they're helping you get to that endpoint.
Right. So, and we have a particular, and you created this process. It's a very practical process that anybody can do wherever, right? You call it the form, feeling, function test.
Right. But I think before we get there, I think it's important to understand about the things that it takes to create that, to actually get that.
You're talking about going from
goal to creating the success.
So what is it, a 4-step process where your beliefs become your habit?
Oh,
or is that the wrong one?
That's thinking.
Oh, we're not into thinking yet.
No, not into.
We're into fantasy.
Still, yeah.
So once a person has created, they've identified their fantasy, and they have their goal, then they move into.
I think one of the key things in conventional medicine at this point is that we're looking at, how that person becomes aware that they can actually create their health. And I think conventional medicine, being developed over the centuries it is because there's been a lack of information available for everybody, and the physician was sought out when they wanted to get rid of a problem, and subsequently that developed into the era of pharmaceuticals and modern surgery and more modern technology, and the approach to medicine has always been the same. And so now there's a vast availability of information, and these thought processes require that the individual actually take ownership of what they want to create.
They should be the CEO of their health.
Right. Right. So, and that's, and that entire concept goes back and evolves around the medical mastermind, and we'll talk about one of these days also, but creating that group of healthcare individuals that actually assist the individual.
You're getting into medical mastermind now, but yeah. I think your focus is on having that patient move out of abdicating their health power.
Right. The turning point there. What is the turning point? And what I see is the frustration with the outcome, is frustration with conventional medical outcomes most often. So what I see in the office is generally somebody who's coming in who's maybe initially responded to conventional pharmaceuticals and this and that and the other, but maybe having, an enormous number of prescriptions and having side effects from the medication, and they're not seeing an evolution
Actually, that's about that kind of turning point is what drove Joan in, right? Because she was diagnosed with multiple issues and given multiple prescriptions,
multiple physicians, multiple issues, connective tissue disorders, all sorts of inflammatory problems, obesity, diabetes, you name it. She had been diagnosed with it and was on steroids and multiple oral diabetic medications. And I think the straw that broke the camel's back there was when her primary internist told her, "Oh, your A1C has not been improving, and you're on 3 medications already. I'm going to prescribe you this 4th one. And by the way, would you like to be on a clinical trial for a 5th
and she
diabetic
wasn't
medication?"
She wasn't old.
No, mid-late 50s, and active, bicycling with her husband, and that was one of the things that we got caught up on, interestingly, and talk about it maybe when we go into the successful health image. But it's she could never get over 11 miles an hour on the bicycle, but she continued to do that. And as we talked about what she wanted to create, it really revolved around being successful with that and some other things. But the turning point for her was when she had that discussion with her physician. And at that point she said, well, and she was articulate, she's well educated, she's on the computer, and not overly so, but used it appropriately for information gathering. And she said, there's got to be a better way. And I think she had seen me do a talk at a Rotary Club event or something of that nature, and called the office and got an appointment. So it's that turning point, I think, is really the interesting thing to think about, because it is what drives us, maybe it's the fantasy that's driving us at that point, to get to that point where we say, well, I really don't want all of this that I have anymore, and I can see a better future for myself, but I got to do something, and so I've got to change something.
What is it when the pain of change is less than the pain of the circumstance?
Right.
Then the change then somebody's actually motivated to make the change.
So that was what caused her to change her thought process.
And listener, if I got that quote wrong, you are more than welcome to correct me, and mess up these things quite frequently.
But she was abiding by Einstein's quote.
About imagination?
No, not about imagination, but we cannot possibly hope to change or to achieve.
See, you're messing up the quotes too. It's not just me.
So it's possibly hope to resolve a problem that has occurred from one way of thinking by continuing that way of thinking.
Oh, right. Mm-hmm.
So insanity is doing the same thing over and over
and expecting a different result. Yeah.
So yeah, and so that finally, that that finally occurred in an intuitive fashion for her. And so she started looking and ended up in the office.
Yeah. And she's been with you for a while. So
Yeah.
awesome. All right. Well, I think we're about out of time, but we're going to continue talking about the law of success in a part 2, right?
Yeah.
Okay. So y'all definitely want to check that out because you need the complete story.
Need the whole scoop.
The whole scoop. All right. Well, thanks so much.
Thanks for subscribing to Your Infinite Health. I'm Dr. Tripp.
And I'm Lene. Until next time, feel it, look it, and live it.